Alright everyone, let's talk about gout case. As we always do, we discuss every case in three angles. First angle, a possible story, how that patient with gout can present in real life and what may be his concerns. Second angle, we check what is written in NICE CKS, so we know the information in a clear-cut way. And third step, I share with you one single peace of mind map that covers everything in one slide. Let's dive in. That is a gout case. Maybe a lady, middle in age or old in age, comes to the GB with sudden onset of big toe pain. That would be the presenting complaint. Big toe pain, sudden in onset, started for the last few days and it's getting worse. Associated symptoms, there will be no temperature, so it doesn't confuse you with infection. And when you ask about maftosa or general well-being of the patient, that patient may be having hypertension, maybe taking thiazide diuretics. Why? Because thiazide can cause hyperuricemia or increases the risk of gout. And of course, in the lifestyle questions, that lady or that patient may be drinking too much alcohol, too much red meat, or maybe overweight, because these are risk factors for gout attacks, or these are triggers for gout attack, and that will be part of your management. When you examine, everything will be quite normal and the image will be quite clear cut as that for acute gout. The patient may have these questions: what is the cause of that? And then you will say multifactorial, for example, or the medicine can contribute to that, some lifestyle habits can contribute to that. Is it curable? Usually gout is not curable, but it is manageable. Will you change my tablets? Of course you can say we'll review that tablet and we'll switch to another one which is less likely to contribute to trigger gout attacks. Part number one is completed. Part number two, we look at what is written in NICE CKS about gout. So of course, how to suspect gout from the story, clear cut from the guidelines, rapid onset, usually often overnight, of severe pain and redness and swelling of the big toe, the first big toe usually. And then management wise, you start by offering something as a first line to treat the attack, and that is usually first line is giving non-steroidal anti-inflammatory drug such as ibuprofen, for example, naproxen. Of course, when you give non-steroidal, you need to give proton pump inhibitor or stomach protection to avoid gastric irritation. Okay, and you advise the patient to continue treatment for 1 to 2 days after the attack. Okay, if the patient is not responding to that, or if he already has tried that from over the counter, for example, you can offer colchicine as a second line. That is what you need to know from guidelines, of course. And then the following, what the patient can do in the management, the patient part, the conservative part, things you can do, Mr. Smith, to ease your symptoms. What will you offer? You will tell the patient to have rest, elevate the leg, that can help, keep the joint exposed to a cool environment, that can help, ice packs can help as well. And again, what is written in NICE about the medicine, if the medicine is the cause of the gout, such as for example thiazide in our case, consider changing to an alternative antihypertensive. So in that case we can change, of course, the gentleman, maybe we can change him back to amlodipine. Do I need to offer prevention or urate lowering therapy for that man? Usually you do not need to do that in the first presentation, but you can signpost to that. If you keep getting gout attacks, we may consider giving you a preventive medicine called allopurinol. What is the indication to offer allopurinol as per NICE? If someone has multiple flares, or someone is on diuretic therapy that I cannot change, or if he has to phi, which is a sign of chronic gout. Okay, so let's start the mind map and it will be covering everything we have seen in the guidelines. Patient is presenting with big toe pain or joint pain. I will start by asking an open question to explore the presenting complaint. Can you please tell me more about that? I will listen carefully and then I will explore Socrates. What is missing from Socrates? When did you start having that pain? Where exactly is that pain? How does it feel like? What makes it better? What makes it worse? So of course I will invest in that. And then second step, as we do every time, trigger. Was that triggered by anything at all? Why? That can give me a differential or can give me a risk factor. For example, if someone tells me it happened after I had a fall or after I had hit something with my toe, that may be something else, like growing toenail, for example. So I'm ruling out that differential by asking that question. Or what was triggering that for you? Was there anything triggering that for you, Mrs. Smith? Yes, doctor, I was in a party and I did eat a lot of, for example, red meat or so. okay, or maybe lots of blah 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 things which can increase the risk of gout, for example. That will be giving you something to rule in or rule out. And then of course I finish presenting complaint by other, and the other are two others as we usually do. One other for the patient to help me. Mrs. Smith, with that pain in the toe, do you have any other symptoms at all? She may tell you, yes, I have some redness or some swelling, which confirms gout. And then I will ask others or other symptoms of the same system for me. What is that symptom? That is a joint symptom, so I will ask about other joint symptoms. With that, do you have any swelling in the joint at all, any redness, any stiffness in your joint? How about your mobility? So I will ask about or any other joints that you have similar pains in. So that will be confirming one story of gout only in 1 minute or 2 minutes. I have the right diagnosis here. Second step, I will ask closed-ended questions to rule out differentials and red flag. What is the red flag? Septic arthritis. So ask about infection. Mrs. Smith, with that, have you noted spiking, that you have spiking temperature, or have you been experiencing any fever at all? That would be usually negative to deviate you from septic arthritis. You can ask about the differential, which is chronic gout to phi. Have you noted any white nodules, for example, in the skin at all? That would be negative in that particular case. You do not need to invest more than that. That is enough. You have a perfect story by now. Go to the third step of data gathering, which is asking relevant maftosa, general well-being of the patient. Have you been diagnosed with any medical problems at all? Yes, doctor, I have hypertension. Do you take any medicine for that? Yes, I take thiazide diuretic. Why that is important? That is giving you the risk factor. How long have you been taking it for? Have you increased the dose at any time recently at all? Any family history of joint problems at all? So that is giving you some risk factors, guys. So ask it in that way, so you show the relevancy. And then ask about lifestyle. Mrs. Smith, do you smoke at all? And then quantify if she does. Do you drink alcohol? Quantify if she does. How about your diet? Do you follow any certain diet requirements? Or how about your red meat intake, for example? Because that will be, guys, giving you the risk factor. If she's doing too much alcohol, for example, as I told you, she's eating lots of red meat, then you will advise that these things may trigger gout attacks. Would strongly suggest if you cut down on these habits. And then we finish every data gathering by psychosocial and ICE. Has that been affecting you, or has that been stopping you from doing anything you used to do? Yes, doctor, it's affecting me, for example, wearing my shoe, for example, or going for doing blah blah blah. And then ask ICE, what do you think may be causing that for you? Anything in particular is worrying you the most? Expectation, were you hoping for anything? I can offer you today. That will be the end of my data gathering, and I will complete it by offering, of course, relevant examination. That will be vitals, because temperature is important to be ruled out here, and of course examining the joint involved. So I would like to examine you, Mrs. Smith. That will include me checking your temperature and as well examining the joint. You'll be given a picture similar to the previous one. Then start your management at least minute 5. Okay, you need to give 3 minutes for management to score 12 here. So start your management the same as I will do now. Having listened to you, Mrs. Smith, having examined you, I think what you're experiencing is a gout attack. Have you heard about gout before? No, doctor. So that is the type of arthritis that causes sudden severe pain, especially in the big toe. It can be treated and it can be prevented as well. So for us to help you with that, there are a couple of things you can do to ease your symptoms, and a couple of things we can offer you to treat that attack. Things you can do: you can have some rest and raise your leg. That will help with the swelling to go down and with the pain as well. Using some ice packs can help with the pain as well, and try to avoid any trauma, because that can trigger the pain again as well. Mr. Smith, we know that drinking alcohol or eating lots of red meat or lots of seafood can trigger gout attacks. Would strongly suggest if you cut down on these habits. So red meat, alcohol, seafood, advice about cutting down, guys. That will be the conservative part. Okay, things we can offer you to ease the attack. We'll give you a medicine called naproxen, which is a good medicine to ease the pain and the swelling and the flare of gout, but that can irritate your stomach. So with that, we'll give you a stomach protection tablet to prevent that side effect from happening. That will be omeprazole tablet you take in the morning with that as well. So that will be my first line. Of course, if that she did try and didn't help, we can go for colchicine, but you will go for that one as a first line anyway. And then I can sign both for prevention. We'll hope to see you again, Mrs. Smith, maybe in 4 to 6 weeks time. In that time, we'll do a blood test to check some crystals in your blood, which confirms the diagnosis. And if you keep getting frequent attacks, we may need to consider giving you a medicine to prevent the frequency of the attacks, but we can talk about that in the follow-up appointment. I will give you a leaflet so you can read more about gout. If you have any questions, you can always call us back for a discussion. So as easy as that, everyone. As you have seen in the mind map, or as I have seen in the guidelines, it is quite simple. If you have any question, you can always text me. I wish for you 12 out of 12. If you need to join the package of all cases and a similar mind map, you can easily text me on that number. Apart from that, it's a clear-cut 12 for everyone. Thank you.